So the certified dietary manager, the dietetic technician register, they can complete the screening information. And then if the resident or patient is not at extremely high nutritional risk, then that individual can also complete the assessment. But a patient who is at high nutritional risk, for instance, someone in the ICU or a burn patient or somebody that is on tube feedings or getting fed through their vein, then the registered dietitian will be contacted and they will complete the assessment. So we have then information on our SOAP note. And in your book, you have a very helpful chart on page 201 that talks about the different information that needs to be put in the SOAP note and where. Okay, so the SOAP stands for Subjective, Objective Assessment and Plan. The subjective is information from the client or from their family that, like, when you're interviewing them, that you're gathering from that person. Objective is any data. Assessment is how you're putting all that together, and then your plan is what you're going to do then to help that person. So basically, this is just a way to help you organize your thoughts and communicate clearly when you're writing a chart note. So again, that chart on page 201 will be very helpful for you. Each facility is going to have their own policies. Like I said before, you need to sign with your credential. Remember that it's a medical document that can be read by anyone. So you want to make sure that you're not, writing derogatory things about the patient or about your interdisciplinary team. For instance, you don't want to throw a nurse under the bus by saying something like, could not evaluate weight because nursing did not complete weights this month. You just want to make sure that you are writing factual information and you are documenting things. Use only abbreviations that are accepted by your facility. So there's some abbreviations in your book, and then you have a nice abbreviations document here that you can utilize as well. All right, so things that we're going to find in the medical record, diet order. This is prescribed by either the physician or the registered dietitian. And this is transmitted to dietary services so that the department can provide the correct type of diet. In a nursing home that are regulated by the Centers for Medicare and Medicaid Services, it is required that they have certain documentation to be completed so that they are reimbursed. So they have a document that's called the MDS, or the minimum data set. Okay, and the minimum data set is done quarterly. So when someone is admitted, they'll have this full assessment in the MDS of an interdisciplinary thing. So a physical therapist is going to fill out a section, speech language therapist is going to fill out a section, the occupational therapist, and then the nutrition professional is responsible for what's called Section K. Okay, so we're doing this full assessment upon admit and then annually, and then a quarterly assessment every 3 months. Basically, what it is it's gathering data, and that's going to provide information to determine if there are any flags or any areas that could be of a concern that require more in-depth information. So the intent of our section of the MDS, Section K, is to prevent malnutrition, dehydration, and ensure the appropriate use of feeding tubes. Okay, so as we are helping the facility complete Section K, we want to make sure it's accurate information, and we want to make sure that we are following up with the different interdisciplinary teams. Let's look at an example of what MDS Section K looks like. So here it is. It's going to ask questions about swallowing disorder, and I'm going to end this video here because I see I only have 10